Thanks to those of you who are joining us. We're just going to allow for a few minutes for folks to file in, and then we'll get started. Thank you for being here. All right, welcome everyone. Thank you for joining us. We're just going to give a couple more minutes for folks to file in and get settled, and then we'll get started. Thank you. Okay, good afternoon, Governor, participants, attendees. My name is Christy Bezanson, and I'm the Director of Results Washington. Welcome to our first public performance review meeting of the year. First, I wanted to offer a land acknowledgement. I am in Olympia, and at my house, I am on the traditional territories of the Nisqually, Coast Salish, Cowlitz, and Squaxin Island peoples. Wherever you are right now, I ask that you also take a moment to acknowledge the traditional tribal territories on which you are located. If you are not familiar, land acknowledgement allows us to insert an awareness of Indigenous presence and land rights in everyday life. Before we get started today, I want to briefly orient you to Zoom webinar. We know many of you are familiar with Zoom meetings, but there are some differences in Zoom webinar, which we're using today. The biggest difference is that you won't be able to talk or have your video visible. This ensures all participants can focus on today's presentation. Notice the Zoom toolbar. You can move your mouse and the toolbar will appear, and you can see icons for the chat and Q&A. We're using chat to share the links to the materials, but chat between participants and Q&A is not available. You can adjust your view to make the presentation or speaker larger by sliding the started today. I want to briefly orient you to Zoom webinar. You can adjust your view to make the presentation or speaker larger by sliding the vertical bar on your screen from left to right. If you end up needing technical assistance, please email results@gov.wa.gov, and we will do our best to help you. Finally, at the end of the session, a survey will pop up. Please take the time to complete this survey. This will provide us with meaningful feedback about your meeting experience. With that, I want to share about the purpose of our meeting today and a little bit about how we got here. The Public Performance Review process, or PPR, is our updated approach to public reviews. We will meet with the governor regularly to share details on a specific cross-agency project tied to his priorities. It will be an opportunity for the governor to hear from those impacted and involved in the project. And it serves as space to talk about the work completed so far to help inform what is needed to get the project to completion. The Results Washington team, serving in a facilitation and coordination role, has been partnering with state agencies to tackle complex cross-enterprise improvement projects. We currently have 6 projects underway. The road to today's public performance review meeting began several months ago, and here's how we got here. We met with agency leaders to identify and finalize improvement project recommendations. Leaders then chose what they wanted to work on and at what level of responsibility. And they identified the appropriate subject matter experts. We worked with those SMEs to home in on a specific scope for the project. It's important to note that the projects selected had to be done within a certain set of criteria, including within existing resources, without policy or legislative action, without IT being the only solution. This meant the project teams had to be very focused and selective in chartering the work. The result are projects that are feasible, attainable, and sustainable. So here's a bit about today's project focus. We are excited to kick off our meeting series by hearing from the sponsoring agencies working on the Goal 4 Reducing Homelessness project. The purpose of this project is to develop, implement, and pilot an adaptable, dynamic, real-time discharge planners toolkit. The toolkit is intended to facilitate coordination between discharge planners and behavioral health crisis stabilization organizations and substance use treatment facilities and the networks of housing and service providers operating in Washington to assist people experiencing or at risk of homelessness. This effort is just beginning, so today you'll hear about the need for the project, how the project will help individuals, and what work is ahead. We look forward to following up next year to hear where the project is at. This is a collaborative, multi-agency project. A special thanks to our sponsoring agencies, the Department of Commerce, the Department of Corrections, and the Healthcare Authority. Today's presenters will cover this project in much, much more detail. We'll hear from the Healthcare Authority team, including voices representing the lived and customer experiences, the Department of Commerce, and the Department of Corrections. First, Governor, I welcome your opening remarks.
Thank you. I appreciate this. Are you hearing me there, Christy? All right. Well, listen, I think this is a perfect subject for the results process because we know that we have a crisis in homelessness, people experiencing homelessness. We know that many folks have mental health challenges associated with it, certainly not all, and we know that we have to have multiple tools to give the people to get them back on their feet. And that means multiple agencies. So I think this is a perfect forum for the state to really combine its resources across multiple organizations and platforms to help people. Because we know these are folks who can do and will get back on their feet if we make this effort to combine our forces in a seamless way that really help people in their individual circumstances. So I think it's a perfect time and place to really move the needle on getting people back on their feet. So I'm looking forward to it. I'm not going to give long pre-oration here. And I'll also say that this is not the only solution to people experiencing homelessness. We've got to have more housing. I say that because too frequently it's forgotten when we talk about homelessness. If we're going to reduce homelessness, we got to have more housing. We're not going to solve that particular problem today. But we also have to have these support systems available to people, and it's connected to providing more housing. So I'm looking forward to everybody's ideas about this. We know we have to move the needle big time, and we know that we can. So I just want to say I'm looking forward to everybody's contribution. Thanks a lot.
Great, thank you, Governor. Before we continue, I wanted to let you all know that you can find today's agenda and slides linked in the chat. Now, Director Birch from the Healthcare Authority, I turn it over to you.
Great. Thank you, Christy, and thank you, Governor, for those opening remarks. I'm Sue Birch. I'm the Director of Washington State's Healthcare Authority. We're the largest purchaser of healthcare services in the state, and we know that health is so much more than healthcare. It's about the opportunities we have. It's about where we live, where we work, where we play, where we worship. And I want to talk a little bit about how Washington took a bold and nationally recognized step in a waiver transformation effort that allowed us to build up these wraparound services. So as the governor said, housing for sure requires that we've got enough units. We've got to have bricks and mortars projects going on, and we count on our Department of Commerce friends to work on that piece. But here at the Healthcare Authority, I want to talk specifically about how housing is a major driver in those health outcomes. When we talk about safe and stable housing and homelessness, we need to talk about, as I said, more than those bricks and mortars units. It's about the service delivery and the supports that make housing work for those transitioning out of inpatient behavioral health settings and other settings like our partners at corrections and at other kind of housing scenarios. We want to keep them from becoming the new chronic homeless. And above all, it's about providing resources and choice and using our limited resources in the most efficient manner. We've got to continue innovating because we know resources will continue to be limited. And for example, we're using that Medicaid waiver, that transformation work to support individuals in finding and keeping housing. We want to extend that waiver to keep this very promising practice in play. We're known around the country for the term foundational community supports. which isn't just supportive housing, but it's supportive employment. So this discharge planners toolkit plays a really important role, and that's what we're going to be talking about today. You're going to hear from members of the HCA team about how that is one more tool and helps us solve homelessness over time. It's the one piece in this very complex puzzle of housing, and it's about what we can do to develop a warm handoff to use those limited resources that we have. And we want to really focus on reducing recidivism by better connecting people to housing. This work takes time. Transforming these large systems takes time. And I'm really proud of the HCA team and all the partnerships that we have leading in and doing this work. So I'm looking forward to the conversation today. Thanks, Christy.
Thank you, Director Birch. We'll hand it over to Melanie Paisolt from Healthcare Authority.
Thank you, Christy, and thank you, Director Birch, and thank you, Governor Inslee, for the opportunity of sharing Wanda's story. Next slide. Wanda was not able to be here with us today, but she gave me permission to share her story. After graduating college in the summer of 1998, she thought she had her life in order. She had a great state job with an exciting career path. She was a single mom of two. She was going to bring all three of them out of poverty. She was on track to buy a house, to make a home. Her plan was very well intentioned, and it seemed like she would eventually have the means to bring it to fruition. Then something happened. First, her father had a heart attack and she struggled to help him with his medical situation. And then she fell ill. She was hospitalized multiple times, sometimes involuntarily. She was terminated from her state job, and she was diagnosed with a severe mental illness. She was advised just to get stable, to take medications and apply for disability benefits, and she was homeless. She felt her mind was broken, her heart was broken, and she was going to be stuck in poverty, renting subsidized apartments if she was lucky. Fast forward a few years, she had been finally approved for disability benefits, and she had come to the top of a waiting list for a project-based subsidized apartment. Her new case manager at the mental health agency asked her what she needed and wanted. She had a college degree that she had worked hard to get and a lot of student debt. She was in her mid-30s, not ready to retire or give up. She wanted a job, and not just any job, a good job. An opportunity to escape from poverty that was trying to swallow her life and her children's lives. Her case manager referred her to an employment program within the mental health agency. And with the help of her supported employment program, she applied for a position with the state again. Her job coach thought she would do well at the mental health division. She had had conversations with how working would affect their benefits, her health insurance, and her housing subsidies, and how she would mitigate some of those impacts. After applying and interviewing, she got the job in the summer of 2008. She said it was such a good feeling to be working again, even if it was for part-time and sort of a low-paying position. She was learning new skills and meeting new people, developing friendships and earning money. Her job coach helped her apply for the healthcare for workers with disability benefits. And even though she had healthcare through her employer, the mental health agency she had developed that therapeutic relationship with didn't accept her employer-sponsored health insurance. And her co-pays for medications that she was using were exorbitant. As the years went by, she worked hard to increase her value to her employer. She asked for more hours, asked for more responsibility, and asked for more pay. Her employer supported her with her goals, and as time went on, her job developed into new roles. However, she still occasionally struggled with her mental health issues. Her subsidized housing ended because she started making too much money and no longer qualified for the program. Eventually, she was hospitalized again, and sometimes involuntarily. She was discharged homeless again. She estimated that in 1 year, she moved about 9 times trying to find a good place to live while still holding down her job. She was trying to rent a room or anything so she didn't have to sleep in her car or outside. That's when the Housing and Employment Program Administrator asked her what would have been helpful for a person in her situation. And we talked about a short-term subsidy to help her with move-in costs and other supports to find, obtain, and maintain housing after being discharged from the hospital. Eventually, she was able to find a room on Craigslist. It turned out to be a good match, and her health improved. In 2015, a position became available at the division, a program manager position for a new supportive housing program with short-term subsidies to help with move-in costs and other supports for people discharging from inpatient settings. She applied and landed the job. The first job that she had had since 2000 that required a degree, with a salary that supports her paying her student debt off, a job that is meaningful with an opportunity to help others that are in situations similar to her own, a job that brings an enormous amount of satisfaction and pride. Her children have grown and are doing well on their own, and she's still making payments on those student loans, but she's making progress. And in 2016, she purchased her first home in Lacey, Washington, and she loves it there. She's also bought a new SUV. What she's truly most grateful for is all the people over the years that believed in her, supported her, and made opportunities available to her, starting with that case manager and job coach. Wanda's story is one of the inspirations for the Discharge Planners Toolkit. How can we support individuals to transition out of those inpatient settings to get access to housing and resources so that they don't become homeless and chronically homeless? Next slide, please. One of the things that we're so fortunate in Washington State for is just the tremendous resources we have in research and data analysis at the Department of Social and Health Services. And even though this data is fairly old, it's from a 2012 report that RDA did, it really tells the story about the need for the Discharge Planners Toolkit. What the report looked at is the number of individuals coming out of two settings, out of the state hospitals and out of substance use treatment programs. And what they discovered through this report was that about 30% of individuals exiting the state hospital became homeless within a year. And in the next slide, even more dramatic, is almost 50% of people exiting substance use treatment programs became homeless within a year. It's these statistics that really demonstrate our need to better connect people to the housing resources. In the reports, it also suggests and looks at how many of those individuals exiting those inpatient settings got connected to resources and services through the homeless management information system at Department of Commerce. And so we see really low percentages of those individuals leaving those inpatient settings and getting connected. And so again, part of the inspiration for the Discharge Planners Toolkit is how do we make a better bridge between inpatient settings, between institutional settings, and getting people connected to the housing resources that are available in the community. This legislative session saw unprecedented investments in housing, and it's just so exciting. But now is the opportunity to really build that better bridge between our inpatient behavioral health settings and those community resources. Next slide. We know from research and data that providing supportive housing services to individuals is a social determinant of health. As we have moved to whole person care at the Healthcare Authority and integrated behavioral health and healthcare together, we are learning so much more about how we treat people with a whole person care approach. And that includes looking at and thinking about where that person's going to lay their head tonight. And so we know from all of the research that's out there that supportive housing is effective, and really those services and supports, that expertise in helping people obtain and maintain housing, and obtain and maintain employment, get access to transportation, nutrition, are all parts of those social determinants of health. And so if we know that that is a healthcare issue, I am so proud to say that the Healthcare Authority is helping lead these efforts to build that better bridge between the services that they're getting in these inpatient institutional settings to the housing resources at our partners in other systems such as the Department of Commerce. Next slide. as Sue mentioned, Foundational Community Supports is our Medicaid 1115 waiver demonstration project, also known as Initiative 3. And these innovative supportive housing and supported employment services and being able to use Medicaid to be able to pay for the services is so unique and unprecedented in the country. And so we are one of the few agencies in the country that have this opportunity of providing these services. And our very preliminary reports on the implementation of these services that started January of 2018 show that when you wrap services around individuals to help them navigate and access housing resources and help them get, obtain and maintain their housing, that emergency room visits are likely to decrease and that inpatient hospitalizations are likely to decrease. And so how do we actually get more of those services into those inpatient settings and build those better bridges? And that's part of, again, why the inspiration of having a discharge planners toolkit is how do we help those discharge planners get access to these services that are available? How do we build those better bridges? Next slide. So I'll pause there to see if you have any questions so far.
Governor, if you're there, open to any questions you might have.
I don't have any questions. I'm enjoying the presentation.
Okay.
Good to see results.
All right, thank you. Back to you, Melody.
So we wanted to invite some of our partners from a facility, from a residential treatment facility, crisis stabilization facility, to give you their perspective on the challenges of helping people get access to housing resources in the community. And so I'm really proud to introduce Craig and Sarah from Columbia River Mental Health in Vancouver to share their experiences.
Yes, hello, Governor Inslee. It's a pleasure to be here today. Hello, everyone. My name is Craig Padgett. I am the manager here at Elahan Place, which is part of Columbia River Mental Health Services in Vancouver. Columbia River itself is a very large organization in our community that is very broad in our service provisions. We have a mission that is to provide behavioral and recovery services that transform the lives of children, adults, and families in the communities here in Southwest Washington. And how we do that is we have multiple services. So we have an adult outpatient service for mental health and SUD services. We provide SUD services to both young adults and adults. We have programs designed for children and families. And then we also have some programs that are working in our jails and around the area here as well. So we're really involved in the areas that are really leading to some of the houseless crisis and homeless crisis out here. Which leads me to my facility. So I'm manager here at Elahan Place. Elahan Place is a residential mental health treatment and crisis stabilization center. We have currently 32 total beds, 5 of which are for our crisis stabilization, separate from the residential program. The crisis stabilization are going to be short-term acute psychiatric treatment and stabilization, and then they have choices of coming back or moving into our residential program and finishing a 90-day treatment program. So Columbia River has currently changed a lot of leadership, and I was brought in as well as we're going to change a little bit and transform Elahan Place. I have a goal of creating a comprehensive curriculum and therapeutic environment that should statistically change the positive changes and transformation in people's life. My goal is to create as much progress as we can in those 90 days. We also provide unique services here that are definitely different than a lot of other facilities I've seen in programs, in which we have peer support services that are on site and working on the co-occurring disorders. And we also provide the unique part of case management. And the case managers here are outstanding. They're involved in our residents' lives. They're helping them, create those discharging plans from the day they get here. And, it's just safe to say that our resources, we know they're there, but it is a time-consuming process to locate, to connect, to understand them, and to get them implemented in a short amount of time. We have to do so. And so I brought Sarah Taylor with me, who's one of our case managers here, who has been with Elahan Place for quite a while. And I can make the best program that could be a go-to program for Washington and everyone in this area. But without the resources and that ability to connect people to rehabilitating services and continued stabilization services, it's really just sort of empty at the end of my process. So I'm going to let Sarah explain from her firsthand experiences on the barriers we face every day and how this toolkit could really help create a more efficient process there. Sarah?
Thank you, Craig. My name is Sarah, and I'm a case manager here at Elahan Place. And I'd like to just talk about planning for successful discharge. So being a case manager has many hurdles, barriers, and limitations that need to be navigated in order to ensure successful discharge for the population that we serve. Some examples of barriers that we see include, but are certainly not limited to, the individual is a smoker, they've been given a low daily rate despite what their needs are, the individual has pets or animals that they take care of, they may have income limitations that really limit their options for independent housing, and then the individual is unwilling to accept anything besides independent housing, which honestly it's a huge barrier, especially when it comes to taking into consideration their treatment, diagnosis, and their capabilities. Another huge barrier that we see is AFH discrimination, which is unfortunate. I'd like to talk a little bit about more current statistics surrounding the cycle of homelessness. According to the National Alliance to End Homelessness, chronic homelessness is defined as people who have experienced homelessness for at least 1 year or repeatedly while struggling with a disabling condition. These conditions can be physical limitations, severe and persistent mental illness, or substance use. In January of 2020, there were at least 110,528 homeless individuals with a history that qualifies under this definition of chronically homeless. Between the years of 2019 and 2020, this number increased by 15%. I think it's important to note that it is extremely difficult for individuals to exit homelessness after their initial stint, and this often leads to extended periods of time stuck in the cycle. Next slide, please. Thank you. I think it's important to talk about the connection between mental illness and homelessness. According to New Horizons, this relationship between mental illness and chronic homelessness is really a two-way relationship. Mental illness oftentimes leads to cognitive and behavioral issues that will hinder an individual's ability to gain and maintain employment. It has been shown that homelessness can exacerbate mental illness and substance use exponentially. This is largely due to the traumatic experiences that really come with being homeless, right? With the proper care options and attention, individuals experiencing mental illness and homelessness can finally break the cycle. So what does breaking the cycle mean? Resources are huge, and as a case manager, I know that the more resources that I have at my disposal, the better I can help my clients. Really, this means all-inclusive wraparound resources for individuals suffering from a variety of different diagnoses. And without these proper resources, we are going to continue to see the following: high utilization of ER and crisis stabilization units, revolving door syndrome, and continued substance use. Next slide, thank you. So what do the resources for success mean? In order to break this cycle, the right avenue and platform for resources need to be created and distributed. Discharge resources are limited, they have barriers, and they're scattered, requiring increased time for coordination and implementation. So that's where we really get into where this Discharge Planners Toolkit can be a significant help in jobs like mine. So I honestly think that it would allow for a more streamlined resource search. I think that being able to spend less time looking for and connecting the residents to these resources is going to help them in the long run. And I think that it allows more time available for discharge planners to implement discharge and follow up once they're into the community. So if you guys have any questions, we're open to that.
Thank you, Craig and Sarah. Governor, do you have any questions for Craig?
Yeah,
and Sarah?
Sarah,
Yeah.
you provided some statistics.
Yeah.
What statistics are there for folks who qualify as chronically homeless? What would we say are the potential parameters of those who have mental health challenges? What percentage have chemical dependency challenges? Are there numbers on that?
Not numbers that I brought with me today. I'm sure that there is plenty of statistics out there regarding differences between mental illness barriers and substance use barriers, if I'm catching your question correctly.
Yes.
Yeah, absolutely. I do think that there are differences, but I also think that a lot of the times those two things go hand in hand. And that's definitely something that I've seen being a case manager and working in a crisis stabilization unit. It's not uncommon to have co-occurring disorder.
No, that's not surprising. I guess one of the questions that of people who when you think of them as chronically homeless, is it more than half have either a mental health issue or a chemical dependency issue? Is it less than half? Do you have any sense of that?
Craig, what would you say? I mean, I feel like a lot of the people that come in here are, I would qualify them as chronically homeless and with severe and persistent mental illness, and oftentimes with substance use disorder as well. What would you think, Craig?
Yeah, I was just trying to chime in and say that in 2 months I've taken over the seat here and watched and really kind of got into who the people are that are coming through here. I can assure you that it's really 99% are chronically houseless and homeless. Just for many years, and it's not a new thing, I don't think, as far as those two coming together. And every one of them that I've seen coming through here are co-occurring. So there's a great link to everybody that comes into crisis or residential here is coming from the houseless crisis, has a extensive history of SUD and an extensive history of some sort of psychiatric disorder as well. And each one does feed on itself. So they seem to have, you can really start to see that half of them half of their barriers are related to the SUD, but they also have those barriers related to the mental health side of things as well. So our population is co-occurring and houseless right now.
Thank you.
Did you have your hand up, Melody?
Yeah, this is Melody Paisel from the Healthcare Authority, and Governor Inslee, we'd be happy to get you those statistics. And research and data analysis did do an analysis of individuals that met the HUD definition of chronically homeless. And I, off the top of my head, I'm thinking it's approximately about 70% have serious mental illness. But we would be more than happy to get you those statistics in that.
Great.
Research.
Thank you.
Okay.
Thanks, Governor.
Melody, we'll hand it over to you.
Great, thank you. So Craig, Sarah, thank you so much for your time today and the valuable insight in the challenges that a crisis stabilization facility has in helping people with housing. As a facility-based organization, it's really challenging for organizations to know all of the resources in the community and keep up with the changes in those resources. And so next slide, also really, I think that we also want to try and do a paradigm shift and really thinking about how do we match people with the housing that they need to be successful. And so, and as well as giving people choice and power and control about where they live and what is that environment that they need to be successful. And so it's really complicated in trying to think about those matches while also giving people that power, choice, and control, and all of the different funding streams that go along with these different choices in the types of housing, the types of services, the housing subsidies to pay for rent, the housing subsidies to develop relationships with private market landlords, the publicly funded housing, or those higher maybe levels of service like adult family homes, assisted living facilities. And so where to go with all of these challenges. And again, I think that that's what we're trying to do is help discharge planners think about those matches that person needs to be successful, but do it in a way that kind of does somewhat of what we're calling an electronic decision tree. And so we can ask some questions that will help guide those conversations to maybe get that person connected to the services that may be specialized in making that match, or getting them connected to some of the housing subsidies that person can use to find the environment that best meets their needs. And so, but it's very complicated. And so the toolkit is really an opportunity to think about using all of these resources in an efficient manner and trying to put all of that, condense that information into this sort of electronic decision tree process. So our goal is to increase that collaboration between the discharge planners, and we're hoping that the electronic decision tree is as applicable to the state institutions, to hospitals, to treatment facilities, but connecting to the homeless continuums of care and the programs and the resources in the community. So we're, ultimately, it really is about helping people and guiding people and giving them choice, power, and control over where they want to live, and providing them information and resources in order to do that. And I think that as we build that bridge, I think it's also about how do we make those connections. So an example, Sarah provided information about the definition of chronically homeless. Well, when somebody's in an institutional setting, their homelessness is sort of suspended. But if the crisis stabilization facility knows that person's been homeless for several years prior to living in that institution, that documentation may actually be very beneficial as they're going out trying to connect to some of the homeless housing resources. And so how do we help our crisis stabilization facilities, our inpatient facilities, document that and provide that documentation to the homeless system of care? And then how do we create those warm handoffs, that connection, so that when that person leaves that entity, that facility, that they're greeted and connected and picked up and accessing as many resources as possible. So it's really about that warm handoff as well. Next slide. So we kind of are taking a three-prong approach to the toolkit. So I've talked a little bit about this electronic decision tree, and we're going to first start with this paper version that sort of does the skip logic of, does that person want to live in this part of town? Have they been chronically homeless? Are they, so asking a number of questions that hopefully will get to some ideas and connections, maybe embed links eventually as we move it to an electronic version that actually has referral forms or referral documents embedded in it, that has hot links to connect people to programs. We're going to start this in a couple of different settings and then be able to get hopefully bigger and broader. So the second prong of the toolkit is really about giving some tools to the individual, so that if that person leaves the facility, that they can take information with them. And so we have a little bit of a draft that our partners in the reentry have developed. And so we want to take that and build upon that. And so it would really be something that we give to individuals, to give to agencies, to give to individuals as they are discharging and have resources that they can take with them. And the third prong of the toolkit is that I don't think there's anything more frustrating, and I've been in Sarah's shoes as a case manager, of having this great list of resources and make a referral only for that agency to say, we're not taking any referrals at this time. And so I think the third prong of the toolkit is making sure that the organizations that are going to be receiving those referrals are prepared, trained, educated about the new referrals that are coming their way. And so how do we develop those relationships and those warm handoffs, but also preparing the organizations to be receiving those referrals? And so that's the third prong of the toolkit. Next slide. So I sort of mentioned that we're going to start this plan, this three-prong approach, with 5 mental health crisis stabilization facilities, as well as substance use treatment residential facilities. And so we're picking these selections of organizations and facility types because we have some things already happening in there, such as some emergency vouchers with wraparound services under our True Blood settlement agreement projects. And so we're working with 5 crisis stabilization facilities associated with the True Blood, and we think this is a great opportunity of better connecting people that may have an emergency voucher with the services and supports that they might need to get more permanent housing, as well as starting to look at bringing our foundational community supports program into residential treatment facilities before that person ever discharges. Can we actually start a housing plan before they discharge? And so those are some opportunities that will, why we're selecting these sites, because we think this will also go along very nicely with the Discharge Planners Toolkit. Next slide. So what we're going to measure for the Results Washington is really looking at the development of the products, the tools, the events that we're using to train staff and community providers, doing some pre and post surveys, surveying discharge planners. How did you like it? What could we do differently? As well as looking at increasing the referrals to programs such as foundational community supports and our housing and recovery through peer services program, as well as even just hits to the virtual decision tree. So those will be the things that we'll be measuring as part of the Results Washington project. So our milestones for the project are to hopefully have a paper toolkit by June 30th. We have some national technical assistance organization that we have under contract with Foundational Community Supports that's helping support us and is actually helping formulate that skip logic for our toolkit. And so we hope to have a web-based electronic decision tree by September, and then hopefully some results of the implementation by March of next year. And then do some analysis and then rinse and repeat. Next slide. And I mentioned our fabulous research and data analysis, and for some late night reading materials, here's some of the research reports that RDA has on their website that just talks a little bit more about the housing status of individuals coming out of facilities, including the 5-part series of reports that they did have some great information, and that does also include coming out of corrections. So there's a lot of great research that RDA has on the homeless population. And so I will pause there and see if you have any questions.
No, thank you.
Thank you, Melody. I appreciate your time. And I will pass it over to Emily Grossman from Commerce. Hi, Emily.
I was getting myself off mute here.
No worries.
Thank you. So my name is Emily Grossman, and I'm a policy advisor in the Community Services and Housing Division at the Department of Commerce. As you know, the Department of Commerce administers state and federal funds for homeless housing assistance, and we also provide technical support to county grantees in designing and administering their local homeless response. We're a natural partner in this effort, and our role is to help ensure linkages between discharge planners and the resources that are managed through our grantees. So that would include local coordinated entry systems. Coordinated entry are the crisis response systems that screen and refer eligible households to a variety of housing resources with varying levels of support So starting with housing navigation with the lowest level of support and moving up the continuum to rapid rehousing, transitional housing, and permanent supportive housing. Also our Office of Homeless Youth, which supports youth age 24 and under, and our relatively new Office of Supportive Housing. So over the past few years, the Office of Supportive Housing has been a real touch point between our housing resources and the Healthcare Authority, DSHS, and other state agencies. So we're excited to build on those relationships and help create better linkages between housing providers, discharge planners, and individuals exiting systems of care. And with that, I'll see if you have any questions. That concludes my remarks.
Well, I had a question. You know, it's often the word relationship is throughout our discussions here. What helps in that regard?
Well, in terms of relationships with discharge planners, I think that this toolkit was really going to help. By helping them understand where they can go to receive assistance in understanding the housing resources, helping them understand what resources are out there. I think in terms of help, having relationships with the individuals who are exiting systems of care, that's really about creating a system where warm handoffs can happen. We really don't want it to be the case that somebody who's exiting, jail or exiting, an inpatient facility just gets a phone number of a housing program and goes on their way. We want there to be a real connection with a real person. So those are some examples of relationships that we would be working on.
Do we envision that this would actually be sort of a real-time resource identifier? I don't think it's going to aim to say I've got 3 units today in Tukwila available, and it's not going to be that real time, is it?
No, and I think it really depends on the program. Like Melody was saying, there's so much variation in programs and how they operate. Definitely programs that are run through the coordinated entry system will not be informing that level of like where it comes down to the number of units. But smaller programs like the PATH program or other programs that are administered by the behavioral health system, I think it could come down to that level of detail. So it just depends on the program.
Got it.
Thank you.
Thank you.
Thank you, Emily. And Governor, we noticed that it looks like your video is off or possibly got flipped off in some way. I'm not sure.
Well, is that back on or not?
There you go. Oh, now you're gone again.
Okay, well, this is an interesting switch. It doesn't tell you which one it's on. How about that?
That looks good. Looks and sounds good.
Okay, thank you.
Okay, yeah. All right, thank you, Emily. And now I'm going to pass it over to the Department of Corrections. I believe Danielle Armbruster is going to speak first.
Yes, good afternoon. Thank you, Christy. Good afternoon, Governor. Danielle Armbruster, Assistant Secretary for the Reentry Division with Department of Corrections. I'm glad to be here today. Next slide, Jessica. So I really just want to start out and talk about DOC's mission and vision and then a few of our values, because I think this work is so critical to support DOC's mission to improve public safety by positively changing lives and working together for safer communities. And I just want to focus on that for just a moment. It takes all of us for safer communities. It's not just about the Department of Corrections or Healthcare Authority or Department of Commerce. It takes all of us to help individuals transition back out into the community. And having a home is just a vital piece of that. In our values, I really want to point out 2 of our values: people's safety and supporting people's success. And what I mean by that is for an individual to release from one of our 12 facilities, our prison facilities, or 12 of our work release facilities, it's critical that an individual have stable housing so that they're able to go to school or go to work or have that really base foundation. And so I think that really supports 2 of DOC's values that are just critical to the organization and the individuals that we serve. Next slide. So I just want to go over a little bit of data of individuals that we are releasing homeless from our facilities. So we release around 8,000 individuals a year, And if you look at these two slides shown in figures 1 and 2, you'll see the trend in individuals that are releasing homeless is on the uprise. And it is kind of in line with the general population, but you'll notice that individuals that are releasing from our state facilities is on a higher rate of increase releasing homeless. And so really, this toolkit is going to help all of us help support those individuals so that they have stable housing when they go back out into the communities. I really am looking forward to our presentation today. We have Angie Sauer next, who's going to really talk about how we help individuals within our health services division with certain special needs to find housing. Angie?
Good afternoon. I'm Angie Sauer, Health Services Reentry Administrator for the Department of Corrections. Health Services has multiple reentry pathways for individuals with behavioral health needs. These pathways include the Offender Reentry Community Safety Program and grants for those with opioid use disorder and individuals living with HIV. Additionally, we provide opportunity to all individuals to complete Medicaid applications prior to release and provide medications at the time of release to bridge access to care in the community. Health Services has social work staff and reentry nurses that work in collaboration with case managers and our reentry navigators to assist with reentry planning for those who have high medical needs, and that includes behavioral health. The Reentry Community Safety Program and the DOH grants for living with HIV have funding and transition staff to assist with finding housing at release. The other identified processes are designed to provide a bridge to access to care in the community in an effort to assist individuals in being able to maintain their housing after release. Challenges include identification of housing resources for those that have behavioral health needs and don't fit into the existing programs that I talked about on the previous slide. For these individuals, it can be difficult to find vendors that are trained and comfortable in working with people who have behavioral health needs. Additionally, there are challenges with getting individuals set up with a warm handoff to a community behavioral agency prior to release. I will now turn the presentation over to my colleague, Steve Dalton.
Oh, Steve, it looks like you're on mute.
There we go. I'm Steve Dalton, a regional housing specialist with the Department of Corrections. There are 7 around the state who work in the earned release date voucher program. We assist all of our community corrections officers and classification counselors and the facility social workers identify people that housing and then help match it up with appropriate type housing. We've developed a statewide housing directory that has a list of housing for each county in the state that will accept the housing voucher and also those who've been previously incarcerated. You know, one of the things with the housing voucher that we help identify the vendors and to become a part of the housing directory. And we also assist them in determining the populations that they'll be working with and most comfortable working with. Another thing that we do is each month we review the list of people coming up to the release dates around the state and identify those that might be in need of housing, who otherwise would probably be homeless. And then we start working with their counselors and other people in the community to try to provide some type of linkage, either program or other resources to get housing. You know, some of the challenges with the housing program is that not everybody qualifies for the ERD housing voucher. Those releasing from jail don't qualify. Those on monetary release don't qualify, and those who don't have supervision don't qualify. And if we run into those people, we try to link them up with a lot of our community providers and also resources that are available through our regional funds with DOC. And some of the community people, to name a few, we work with, like Seattle through the Metropolitan Urban League, WeldWorks, the Freedom Project, and they help us provide housing, job training, and mentoring. Some of the problems with getting vendors is some of the smaller counties don't have the resource to provide housing, and so the large counties get overburdened, and then vacancies don't occur. And also, even some communities put up obstacles through zoning restrictions that make it difficult for vendors to establish housing in different neighborhoods. One group that's particularly difficult to place are sex offenders. As most people know, they're not welcome in most communities, and a lot of our vendors, they have a lot of geographical issues to deal with in placing them away from high-risk areas, and then dealing with some of the law enforcement notifications that might cause neighbors to push back. So a lot of our vendors who might want to serve that population, they choose to serve an easier to place groups. Another one of our challenges is just dealing with people and filling out applications, some who have behavioral challenges, who can't write. They have to interview and fill out paperwork. And even some who are accepted into our program, they get eliminated because of behavioral issues. They've been accepted, but then they lose their place. Vendors don't want them because of issues that occur in the institution. Another area we're working on as a challenge is transportation. A lot of people exiting the facilities, if they don't have family or friends or vendors that are willing to pick them up, they're often placed on public transportation with all their belongings with the hope that they'll show up where they're supposed to be, and that can present a challenge. Post-release, we always hope that all of the people that on the voucher will be able to establish themselves on their own resources at the end of 3 months, but often that doesn't happen. So we try to work with community members and resources to provide some type of seamless continuum of care for those folks. And this toolkit, it'll be just extraordinary to be able to work with people throughout the system. We say that once people enter the Department of Corrections, our job is to get them ready to reenter the community. And this toolkit will start providing tools, I think, for people that will be working with them along the way to start looking at the options for housing, and even when they're out in the community, when they finish with the voucher or they come out homeless. So that concludes my presentation. If you have any questions, I can answer them now.
Thank you, Danielle, Angie, and Steve. Governor, do you have questions?
Yeah, Steve, you made reference to a group of people who are not eligible for either vouchers or something else, and I missed that. Who are you referring to and what program?
Yeah, when the Earned Release Voucher Program was established in 2009, it was established as a last resort program that for people who had no other resources to get out, they could get the voucher, but they had to be under supervision in order to qualify. And people who releasing from jails, we don't deal with that population, and people that are on monetary releases or told causes, they don't have the supervision that qualifies. And so when we run up with those people, we try to get other resources to step in.
I'm not sure why that limitation would exist. What was the rationale for that?
I think it was just to deal with a lot of people that if they don't have supervision, they're going to release on their earned release date to begin with. I think the origins of the program was during the last financial crisis back in 2008, and all agencies were kind of tasked with finding ways to save money. And we found that there were people staying in prison for years beyond their earned release date, only because they had no resources and no way to get out. And so the legislature established this program to help that population. And that's kind of where it stayed. We did a pilot project a couple of years ago at Purdy that we applied funding for anybody releasing from Purdy who thought they'd be homeless was eligible to apply for the voucher program. And we ended that last year, but we found down at Purdy there were a lot of women releasing who had, because of the crimes, they didn't have supervision and they were going to be releasing homeless or back to situations that wouldn't be helpful for their successful transition. But that was just a pilot project.
Well, this is worthy of looking at this issue, I think.
Yeah.
So I'll ask the rest of my staff to think about that. Could I ask you a question of Craig and Sarah and Wanda about this toolkit? To what extent will it help us coordinate the mental health and the housing resources on the same phone call or the same text thread? How will it function in that regard?
This is Lee from the Healthcare Authority. So I think one example might be, so if the electronic decision tree, as the discharge planner is talking through the different scenarios with that individual, and they are interested in going out into their own apartment, but maybe they need a housing subsidy. They may need somebody to contact a landlord on their behalf, apply for some different housing subsidy resources. So the discharge planner, as they're walking through those, that skip logic in the electronic decision tree, that it may be that person is referred to our foundational community supports program, or maybe our HARPS program, or our housing and recovery through peer services program. And so that embedded in the electronic decision tree would be a referral form that the discharge planner could make a referral to those services before that person is discharged, and be able to, have that housing assessment developed before that person leaves the facility, maybe having that supportive housing provider actually contacting landlords on a person's behalf before that person ever leaves the facility. So that would be, again, kind of that warm handoff between the facility and the service providers in the community.
Got it. Thank you.
Oh, sorry. And I also think that from our perspective, I believe that, as a director kind of overseeing the whole operation, it's really an imperative piece that can keep focus and utilize our time more efficiently. For me, my goal with this is to watch our case managers be able to link and refer and produce some type of housing before they leave, in a much more expedited way, which, for me, I think we can open up more time if we have a centralized resource that's very efficient, so that we can actually expand our case management role a little bit more, and maybe even do a little bit more for residents before they go out. So I think for me, it just opens more possibilities, and it just creates more efficiency for my case managers to link, to get referrals out, and to know exactly what we need to do in a shorter time frame.
Great.
Okay, thank you. Other questions, Governor?
Not at the moment.
Okay. Well, I wanted to thank all who attended this meeting today. As a reminder, please take the time to complete the survey that will pop up at the end of the meeting. And thank you to our agency partners who helped bring this project work to the fore. We are so appreciative of the partnership with the Department of Commerce, the Department of Corrections, and the Healthcare Authority. And thank you to Sue, Melody, Wanda, Craig, Emily, Danielle, Angie, and Steve for being a part of this work. Thank you to the Results Washington project leads, Jessica Dang and Sharice Pidcock, and to all of the Results team members for their parts in making this work possible. And thank you to my leadership, Kelly Wicker, the Deputy Chief of Staff, Jamila Thomas, the Chief of Staff, and to you, Governor Inslee, for your support of me, the Results team, and the shared work with our agency partners. And with that, I will turn this back to you, Governor.
Thank you. First off, if anyone sees Wanda, please express my appreciation for sharing her story. We really appreciate courage in that. It helps us guide these efforts for somebody else. Just a couple comments about the benefits to the people we serve are obvious here to make this system more effective for individuals. But I want to point out it helps the whole government to become more efficient as well. We're basically enabling our state employees to be more effective by giving them tools to be effective earlier rather than later. So this is a benefit for the individuals. It's benefit for the whole organization as well. And this is exactly what Results is intending to accomplish. So I want to thank everybody by putting a little sweat equity in early. We're developing intellectual capital here that we make an investment in earlier. That saves us a lot later on operating costs and time as well. So I think your investment is well worth it. And I'll look forward to following up on this to find out when it's complete, to see it in operation. That'll be fun. So thanks for everybody for your contribution. Please be well. Take care of yourself. Christy, thank you for leading this effort. Go Mariners. Take care.
Bye. Thank you.